Hello everyone, I'm Kuder with Solidarités Internationale in Yemen. Today I'm presenting findings from our field study that explores how local agroecological practices can help address one of Yemen's most pressing challenges, water scarcity. Through our R-Wash project, we started tackling this issue by improving wash services and increasing the availability of information on groundwater, but soon found that the majority of this information lies within the agricultural sector, the largest user of water in the West Coast. The innovation builds on the Resilience Wash project, which aims to enhance resilience against waterborne diseases and water scarcity by improving access to safe water and sanitation. The study focuses on the West Coast, where over 90% of extracted groundwater is used for agriculture, but much of it is lost due to inefficient irrigation. We looked at how communities are already managing cultivation and water use, and how agroecology can offer low-cost, locally adapted solutions that conserve water while improving food security. Communities in Yemen face a deadly conversion of water scarcity. Groundwater levels are declining rapidly due to erratic rainfall and over-extraction for agriculture, aggravated by extended periods of drought in recent years, as Yemen is the third most vulnerable country to climate change. This is causing inefficient access to drinking and domestic water, where 17 million lack access to water to cover basic needs, exacerbating outbreaks of waterborne diseases such as AWD and cholera, with over 250,000 cases confirmed this year. Second, we have food insecurity. Poor soil health, unreliable water for irrigation, and fragile livelihoods leave many households without enough food, where 49% of the population is food insecure and 5.1 million people living in IPC severity level 4 areas. Third, we have malnutrition, especially among children and women, remains alarmingly high. 55% of children under 5 suffer from chronic malnutrition, with 500,000 suffering from severe acute malnutrition. But these problems don't exist in silos. They are deeply interconnected. Lack of access to clean water increases the risk of waterborne diseases, which worsens malnutrition. Unsustainable water use limits agricultural potential, poor food availability worsens health outcomes, and malnutrition makes communities more vulnerable to shocks. Our study sought to understand how existing local practices might break this cycle. As part of the WASH project, and in order to ensure sustainability of WASH services, we wanted to look at water resources management and water service management. However, we realized that the main source of water, groundwater, was relatively unknown. We did not know the extent of its availability or quality, nor did we know its usage and its abstraction. As part of our WASH resilience project in Yemen's west coast, we conducted a hydrogeological study with groundwater relief to understand groundwater extraction patterns. The results were eye-opening. 90% of groundwater is being extracted for agriculture, particularly irrigation. But most of that water is being wasted due to inefficient irrigation techniques and overuse. We also observed a rapid increase in onion cultivation, and noticed that farmers with similar plot sizes were using vastly different amounts of water. These patterns raised serious concerns about agricultural water practices. The main recommendation was to investigate agricultural practices. That's what prompted us to dig deeper. We wanted to understand not just how water is used, but how farming systems, crop choices, and irrigation behaviors are interacting with groundwater stress. We chose agroecology as our lens to explore these questions, with a particular emphasis on water use, aiming to inform future access to drinking and domestic water, thus our WASH programming, specifically when it comes to water conservation and awareness raising. We aimed to identify agroecological practices already used by communities that supports food production and conserve water. The objective was to understand how these practices function in both rain-fed and irrigated systems and assess their feasibility for broader adaptation. The innovation tackles water scarcity through a holistic approach to water management, optimizing water use in agriculture, the main consumer of water. By reducing groundwater dependency in farming, the project ensures increased water availability for all users, including safe drinking water to reduce risk of waterborne diseases. It integrates gender-sensitive approaches, prioritizing women farmers, and creates actionable solutions, including water-efficient irrigation techniques, and crop diversification. The study was conducted in Al-Mocha, Al-Khawkha, and Hais. We used key informant interviews, community consultations, and participatory mapping to document practices. We focused on practices that emerged from local knowledge and addressed both food and water challenges. This process emphasized understanding what is already working on the ground. We documented a range of locally used practices, including composting, crop rotation, intercropping, mulching, natural pest control, and kitchen gardening. These practices vary between rain-fed and irrigated areas. In many cases, they were maintained by women or youth and adapted to household constraints and available resources. The study estimated that more than 90% of annually consumed water goes to meet agricultural demand. Out of this, only 40% is actually used by plants, and the remaining water are wasted either as deep percolation or as evaporation. Another challenge identified include the depletion of groundwater due to excessive pumping using solar energy, which threatens the sustainability of these resources. The renewable water availability has dropped from 128 cubic meters per person in 1997 to 74 cubic meters in 2017. All this puts Yemen at extreme risk of water scarcity. Only 25% of respondents had adopted agroecological practices. Compost use was reported by around 29%, while zero-tillage adoption was just 12.5%. Rainwater harvesting was used by 23% of male respondents and 13% of female respondents. Many of these practices face barriers, including access to tools, water, and technical knowledge. However, some, like kitchen gardening, were widely practiced and maintained by women and youth. A central finding was how agroecological practices influence water availability and conservation. Techniques like mulching, intercropping, and composting help retain soil moisture, reduce evaporation, and limit the need for irrigation. Farmers using drip irrigation systems reported up to 35% water savings compared to traditional flood irrigation. In some areas, greywater reuse was also practiced for home gardening. These practices don't just conserve water, they help preserve groundwater resources, making more water available for essential domestic and drinking needs, and reducing the risk of waterborne diseases in communities. Local knowledge and social learning were pivotal. Most practices were built on generations of adaptation, maintained by women and youth, and refined through informal networks. However, capacity gaps remain. Only 18% of women accessed extension support, compared to 40% of men. This disparity limits the adoption of water-efficient practices. Scaling agroecological methods must prioritize inclusive learning, empowering those most involved in both farming and domestic water use, especially women. We recommend systematic piloting of promising practices in both rain-fed and irrigated systems. This includes supporting water-saving techniques like mulching, greywater reuse, and efficient irrigation. Interventions should be paired with awareness raising on water conservation, not just for farming, but to protect drinking water sources. Programs should strengthen the links between agricultural water use and public health, ensuring that groundwater depletion in farming does not undermine WASH outcomes. Prioritizing women and youth in training and decision-making is essential to sustain and scale these solutions. This study confirms that agroecological practices in Yemen's west coast offer a viable community-driven response to water scarcity. By reducing groundwater pressure in agriculture, they help safeguard drinking water, support food security, and improve public health outcomes. Addressing water stress holistically through farming, WASH, and community engagement offers a scalable model for resilience. These practices are already in use. The opportunity lies in recognizing, supporting, and expanding them. Thank you.